Welcome to Think Like a Nurse, the place where we break down clinical reasoning, exam strategies, and real-life nursing scenarios so you can think clearly, act confidently, and practice safely. My name is Love. Today, we're tackling one of the most common and stressful questions nursing students face. Who do you see first? This question shows up everywhere, in exams, simulations, clinicals, job interviews, and real hospital shifts. And here's the truth. It's not about speed. It's not about who complains the loudest. It's not about wrecking the most sympathy for. At the end of this practice, you'll have a practical mental framework you can use on exams and in real life. A system that makes priority questions feel logical instead of stressful. Let's start with why priority questions are so important. Nursing is often a balancing act. On any shift, you're managing multiple patients, each with needs, complaints, and potential complications. The challenge is knowing who is truly unstable. Picture this. You're the RN on a medical surgical floor. You have an LPN and a CNA on your team. Patient A needs a post-op assessment. Patient B has asthma, wheezing, oxygen saturation 88%. Patient C is post-op, with pain at 8 out of 10. Patient D has hypertension and needs routine medication. Who do you see first and why? At first glance, your instincts might pull you toward the patient in pain. Or the one, which patient is actually unstable? Well, I see the patient with low oxygen first because airway and breathing take precedence over pain and routine care. If you fail to address patient B immediately, their condition could deteriorate quickly, leading to respiratory distress or arrest. Even in real practice, this isn't theory, it's a principle that saves lives. Now, let's make it more complex. In the ICU, stakes are higher. You're managing 3 patients. Patient I is post-cardiac surgery. Telemetry shows PVCs. Patient J requires routine turning to prevent pressure injuries. Patient K, post-op chest tube, small drainage, stable vitals. J and K are stable, routine care. Patient I, however, shows subtle arrhythmia. Patient J and K are stable, routine care. Even small deviations can escalate quickly, so the RN's attention goes to patient I first. This demonstrates a critical principle. Priority isn't always obvious. Subtle changes may indicate serious deterioration. Always observe carefully and act proactively. Priority thinking applies to pediatrics too. For example, Child A has a fever and signs of dehydration. Child B needs feeding assistance. Child C needs routine medication. Which do you attend to first? Child A. Even if Child B cries loudly, your priority is Child A. Early intervention prevents complications. Pediatric exams often test your ability to notice subtle cues because symptoms may escalate quickly in children. Priority questions often appear deceptively simple. Some common mistakes we make when answering priority questions. Focusing on the loudest complaint, ignoring subtle warning signs, restlessness can fuel all vital changes may indicate serious deterioration. Failing to reassess, delegated tasks require follow-up. A previously stable patient may deteriorate. By learning from these mistakes, you will strengthen both your exam performance and your real-life nursing judgment. Now, here are strategies for tackling them. Ignore noise. Loud complaints or dramatic stories do not equal priority. Always start with ABCs. Life-threatening conditions come first. Assess stability. Stable chronic conditions, routine care, or comfort measures come last. On exams, justify your choice logically. It improves accuracy. In real hospitals, the priority patient may not be obvious at first. Experienced nurses scan the floor, observe body language, check vitals, and anticipate problems before they manifest. Priority thinking is a habit developed over time through repetition, observation, and reflection. New nurses often focus on pain management or routine tasks first, missing silent deterioration. Mastering priority questions is less about memorization and more about thinking like a nurse. Priority thinking bridges the gap between exams and real-life nursing pressure. It transforms theoretical knowledge into practical decision-making, ensuring patient safety and confidence under pressure. Every shift, every exam question, and every patient interaction becomes clear once this mindset is internalized. The question is, who do you see first is no longer a trap. It becomes a framework for safe, effective, and confident nursing practice.
So comment, like, and share for more episode. Bye!